Right. I'm talking
Dr.
about
Lennis,
Appendix B right now.
Yeah.
The specifics of how this study was going to be conducted are contained in Appendix B to this agreement.
Yeah.
And I was asking you a more general question. What is the significance of these particular requirements to the scientific study?
Of having something like Appendix B?
Yes.
Yeah. In today's environment, it is really important that there's human subjects approval, that anything involving human subjects is very carefully looked at, so that the patient is knowledgeable of everything that will occur, and that when a study like this is performed, that there is an understanding between the patient and the doctors who are performing the procedure that is fully understandable by the patient.
Okay, so you're talking more from a patient standpoint, as having the patient informed and the doctor advising the patient of what they will be involved in. Is that right?
That is correct.
Okay. What about from a scientific aspect? What is the significance of protocols such as Appendix B?
The significance of a protocol from a scientific aspect is that it is done in an efficacious manner, so that the basic rules of scientific methodology are carried out.
Okay. Okay. In other words, does it affect the credibility of the project in terms of how the scientific methodology is carried out?
Objection, overly broad and vague, but if you can answer.
Could you repeat the question?
Well, I'm just, you were saying that there's a reason for following protocol, and you said that it makes sure that scientific methodology is carried out, correct?
Mm-hmm.
Okay. And does that then affect the credibility of the study?
It should.
Okay, it should. In this particular instance, did you know that certain patients were to be excluded from the study?
Correct.
Okay. Can you name what patients were to be excluded?
Yes. My recollection is that the patients to be excluded from the studies are individuals with some general health conditions that might not be appropriate for the study. Individuals, for example, who are diabetics.
And what is the reason to your knowledge, diabetics would not be good candidates for a Sargon implant?
Excuse me, for the study?
Yeah, for the study.
A diabetic it is a given that a diabetic has much more difficulty with healing than an individual who is not a diabetic.
And when you say that's a given, is that generally accepted in dental circles?
Dental and medical circles.
Okay. So the healing process
is compromised.
Any others that were to be excluded from the study?
If I recall, individuals who were heavy smokers were also to be excluded.
Now you're making a distinction between heavy and light smokers, or are you just saying?
I said if I recall.
Okay, so it's heavy smokers is what you recall. What
I recall is people who had a history of heavy smoking.
Okay. And the reason why heavy smokers would be excluded from the study is
because with smoking there is the possibility of also affecting the healing process because smoking is an irritant. As a result of an individual being a smoker, the irritants as a result of smoking could cause some problems.
Irritants in the mouth or in a particular area?
In the oral cavity.
Oral cavity, generally. Okay. Any others that you recall were to be excluded from this particular study?
I believe that's all I recall.
Do you recall if persons over a specific age were to be excluded from the study?
That could be, but I don't recall
You
that.
don't recall that. Okay. If you knew that diabetics were being included in the study in violation of that particular protocol, would you have objected to that?
Objection, incomplete hypothetical.
I'm just asking.
Could you repeat the question, please?
If you knew that diabetics were being included in this particular study, if you knew that, would you have objected to that?
Objection calls incomplete hypothetical. Does it matter if anyone agreed to it or not,
No,
or
I'm
is it just
asking if-
hypothetically?
hypothetically, if you knew that that was happening, would you have done something about it?
Hypothetically, if I had known and if in the protocol it was written not to have diabetics, I would have objected.
Okay, and that would be true for people who are over, say, 65,
Whatever would,
if that violated the protocol,
yes,
and the same for smokers?
that is correct.
Okay. Do you think that Dr. Lazaroff would have objected to that if he knew that was happening?
Objection, that calls for speculation as to what Dr. Lazaroff might be thinking or not thinking.
Do you know?
I don't know,
Anybody?
but I would believe he would have.
Okay.